Good morning or good afternoon, depending on where you are joining us from. Welcome to today's presentation, Promoting Retention of Healthcare Professionals, the Importance of Mentorship Modules. This webinar is the first of N4's employer series on recruiting and retaining international experience. Towards the end of the webinar, we will be sharing a new tool N4 has developed to support healthcare employers to create a workplace which welcomes and ensures a sense of belonging for internationally educated health professionals. Before we begin our presentation today, we would like to begin with an acknowledgement that N4 is hosted at CHEO, which is located in Ottawa, Ontario. Ottawa is built on unceded Algonquin Anishinaabe territory. The peoples of the Algonquin Anishinaabe Nation have lived on this territory for millennia, and we honor them and this land. Their culture and presence have nurtured and continue to nurture this land. We also honor all First Nations, Inuit, and Métis peoples and their valuable past and present contributions to this land. My name is Mariah Maddock. I am N4's team lead of knowledge development and mobilization. I will be hosting and moderating today's webinar. And I'm joined here by my colleague, Andrew, who will be the co-host for today and be monitoring the question and answer box and the chat box. And I'm now very pleased to introduce you to today's presenters. And presenters, I'm going to ask that you turn on your video as I introduce you if you're able to do so. So our first presenter today is Dr. Catherine Baxter. Catherine has worked in nursing education for over 20 years in teaching and administrative positions. She has experience in curriculum design, development, accreditation, project management, and program evaluation. Catherine is recognized nationally for her expertise in bridging education for internationally educated nurses. Welcome, Catherine. Thank you so much for being here. And our next presenter is Susanne Priest. Susanne is the Director of Nursing Retention Model of Care at Horizon Health Network. She obtained her bachelor's and master's of nursing from the University of New Brunswick and has worked in both the state of Maine and New Brunswick. Her early years of nursing included neonatal intensive care unit, First Nations community health nursing, 12 years with the nursing regulatory body, and the Department of Health as a palliative care coordinator. She rejoined Horizon Health Network as the Director Nursing Retention Model of Care in July of 2022, and since then has been leading a team of nurse mentor coordinators. Welcome, Susanne. Thank you so much for joining us today. Today's session is being recorded and will be uploaded to our N4 network platform as soon as it becomes available. Should there be any technical difficulties during this presentation, we will inform you with details for an alternate makeup session. And before we begin today's event, I would like to take a moment to introduce you to our platform features on Zoom to help enhance your participation experience. Throughout today's webinar, we invite you to write your questions in the question and answer window. And we know that sometimes many of you might have the same question or be interested in a particular response. So today you have the option of upvoting questions that you're interested in hearing the answer to. We will prioritize the questions that have the greatest upvotes first when we pose them to the speakers. And with that said, let's jump right into today's presentations. I will pass the virtual podium over to Catherine first.
Thank you, Mariah. Just share my screen. All right, hopefully you can all see that. And before I begin my presentation today, I'd just like to acknowledge that Brandon University is located on Treaty 1 and Treaty 2 lands, and that's the traditional homeland of the Dakota, Anishinaabe, Cree, Oji-Cree, Dene, and Métis peoples. So my presentation today is going to focus on really looking at the retention of internationally educated nurses. But when we look at the issue of integration and retention of internationally educated nurses, we realize that it really begins with the very beginning stages of recruitment. Let me just get rid of one part of my doc here so that I can advance the slide. That's not, there we go. What I'd like to do today is really go through some of the research, but not in a very researchy way, hopefully in a very conversational way, and sort of look at some of what we know from a research perspective and a program evaluation perspective about internationally educated nurses and the recruitment, integration, and retention of those individuals into our workplaces. I work, Brandon University is located in a small city in rural Manitoba. And so some of the focus of this is going to focus specifically on rural settings, but much of it applies to any setting that an internationally educated nurse is coming to. So I'm going to talk about recruitment, integration, retention, and then if we've got time at the end, I would like to go through some of these key elements, and that is referring to really a policy framework that's evidence informed, looking at some of the things that are important if you are embarking on a recruitment campaign or the trying to recruit internationally educated nurses into your organization. Okay, so if we begin with recruitment, so there are different types of recruitment campaigns, and we're probably hearing a great deal about many of them throughout the country. Some jurisdictions are undergoing active recruitment campaigns where they're actually going to source countries and recruiting directly from those countries, bringing internationally educated nurses over and hiring them into positions. There's also examples where there are private recruitment agencies that are independently recruiting internationally educated nurses, and they're coming over and then beginning the integration process when they arrive. And when we are talking about recruitment from source countries, one of the most important factors for us to really take into consideration is that we're adhering to ethical recruitment practices. So ethical recruitment is certainly possible. There are some very good examples of ethical recruitment. But when we're embarking on these kinds of active recruitment campaigns, it's really important that we're adhering to global codes for ethical recruitment, and that we are really making sure that we are bringing people in and making people very aware of the positions that they're coming to. So I could speak for an entire 20 minutes on ethical recruitment, and I won't do that. But a few of the factors that are important to consider is that it's important to consider and review and adhere to ethical recruitment guidelines and policies. When we're recruiting registered nurses from a source country, it's important that we recruit them to a similar position here in Canada. So RNs are recruited to RN positions. It becomes much muddier if we recruit RNs to healthcare aid or health support worker positions. It's also important that recruitment is one piece, but we have to recognize that if we are recruiting people actively from another country, they are going to need supports upon arrival, and those would be workplace supports as well as immigration and community supports. One of the things that really makes ethical recruitment a reality and also supports retention in the long term is when you're able to offer long-term employment commitments to internationally educated nurses. So they're coming for a 2-year or a 3-year employment commitment. So it's much more likely that they're going to feel like they're going to settle when they arrive. And because one of the things that Canada has going for it as a country, Canada is not always the country of choice for international migrants. It's up there, but it's not always the first choice, except for the ability for individuals to bring family members to Canada and have that family reunification. It's an important component to migrants when they come, and it's an important factor that Canada can contribute. So when you're building in those kinds of active recruitment campaigns, it's important to think about the long term and the individual's desire to bring family members with them. The other type of recruitment for internationally educated nurses that we have is really the recruitment of internationally educated nurses who are here already. So these are individuals that are in Canada looking at working their way through the licensure process and then looking for employment. And one example I have of a very successful recruitment occurred in Manitoba. It was the Rural RN IEN project. And they identified IENs that were working their way through the licensure process. They recruited those IENs and they assisted them with licensure support. So with bridging education and then writing their licensure exam, and then offered them employment contracts, and then relocated them to rural Manitoba. And that we've just completed a 3-year evaluation of that project, and it had very high levels of success rate for retention. For the IENs themselves, in terms of participating in it, they often hesitated. They were unsure whether they wanted to live and work in rural Manitoba, especially if they had no ties to the community. But for those that participated, the opportunity to access bridging education, a faster route to RN licensure, and guaranteed long-term employment as a registered nurse, along with some financial assistance supports that were provided, really tipped the balance and made them quite interested in participating, and was quite a successful way to move internationally educated nurses into some rural vacancies. So when we talk about integration, there are 2 steps to integration. There's integration into the workforce itself. So this is the licensure process that is required for any internationally educated, regulated profession. They have to work through the process of becoming eligible to work as a professional in a particular country. Within Canada, our credential recognition process for nurses is provincially regulated, and it involves several steps that involve the recognition of credentials, meeting the language requirements that are established for the profession. In some cases, it will require bridging education, or this could be called gap training, or it may be a series of modules that IENs have to take, but there may be knowledge gaps that exist that have to be filled. Once those knowledge gaps are filled, then they are eligible to write licensure exams. So there's a lot of literature on barriers and challenges that internationally educated nurses face at this phase in the integration. Sometimes they are unable to meet the language requirements. Maybe there's not enough high-level language courses available for them to take. Maybe there are long wait lists to get into bridging education, or not clear pathways to meet the knowledge deficits that have been identified. I would say that overwhelmingly, the research really talks about breaking down those barriers. So making sure that IENs have access to the resources and supports they need in order to support language development, ensure that they have met the competencies for knowledge, skills, abilities, and understand nursing practice in Canada. So breaking down those barriers is very important, ensuring that IENs have the ability to work through those requirements quickly, that there's not too many costs associated with it. Getting internationally educated nurses into the workforce relatively quickly is good from many different aspects. But the research doesn't support changing or lowering the requirements. If language requirements were lowered too much, then what it does is it actually impacts on their ability often to integrate successfully into the workplace when they get a job. It impacts on communication. So it's about breaking down barriers and ensuring that internationally educated nurses and other professionals meet the requirements and are adequately supported through this process so that they have the knowledge, skills, and competence once they get into the workplace. Then we look at workplace integration. So this is now they're registered, they get their first job, they start in their positions. And what is the research showing us about some of the challenges and things that really are beneficial? So this particular information comes from the Rural IEN pilot, the evaluation that we conducted. And I included it because it was conducted over 3 years. So it followed nurses from their first year, their second year, and their third year in their positions. And so we were able to see how they developed and where some of the sticking points were and where some of the real benefits to providing support. And Susanne, in her presentation, I believe, is probably going to touch on a whole lot of this in terms of the modules. But this was what we found. So all of the IENs that participated in the RN pilot had gone through a bridging education program. So they had all met the requirements for licensure, but they had gone through whether it's called a gap training or a bridging program. And it was a 6-month program, and it included a 6-week clinical practice component. So when we talked to the nurses, they all felt that they had the knowledge. They felt that they were competent in their knowledge, skills, and abilities. What they really lacked was confidence. It was a new setting. They were applying this new knowledge in a new way and working with a different population of clients. And so it was about building confidence. And confidence came up. We interviewed both managers and the internationally educated nurses, and confidence came up from both. So in year 1, it was really the need to build confidence. In year 2, it was growing confidence. And by the end of year 3, they had a very healthy confidence. They had the confidence to take on charge responsibilities. They were acting as preceptors. They were fully integrated and felt really very confident, but it took time. And certainly at the end of 1 year, they were not yet confident. And at the end of year 2, they were getting there. But by year 3, they were really feeling comfortable. The other piece, the next one was the Canadian RN practice. And here, again, it was getting used to the role and scope of practice of a registered nurse in Canada, which can be quite different. It can even differ related to the different settings that you work in. Really what both the internationally educated nurse and managers found helpful in this piece was that giving information in small increments, adding responsibilities slowly, so not overwhelming IENs right away. Very difficult in the reality of today's workplace, but trying to incrementally and provide supports. And again, by year 3, they were feeling very comfortable with Canadian RN practice. The attitudes of others, not surprisingly, when their colleagues and peers support them, that's very beneficial. Unfortunately, racism and discrimination is experienced in the workforce, and certainly policies need to address this, but also more than policies, people need to follow up, managers need to follow up, and IENs need to be equipped with the skills to react to it, to respond to it, and also with the information as to how they seek assistance if it becomes a challenge within the work setting. Supports from managers, from educators, from other nurses was very influential and important in their integration. And regardless of what we had provided in the bridging program for the internationally educated nurses, there was also a reality that they needed additional employer orientation and information specific to rural nursing practice. So the idea of every rural facility was slightly different. Some are larger, some are smaller. Who does the RN call? What are their responsibilities? All of those pieces were important to continue to provide support and information to IENs over time. And this last point I've included because I thought it was kind of an interesting piece for discussion. And it was the, in Manitoba, rural facilities and most of our healthcare facilities have an English-only workplace policy in English-speaking facilities, so that you can speak any language you want on your breaks, but when you're on the unit, you have to speak English and communicate in English. Internationally educated nurses found this to be a very restrictive and discriminatory policy. They didn't like it. They were feeling stress in the workplace, and if they felt they would want to talk to someone in their own language because it was more fluid, it was easier. On the other hand, managers were really very supportive of this policy and felt it was a very important policy. So there was a disconnect. And I just leave that with you to think about. It was the IEN's perspective on this policy was very different from the manager's perspective on it. And so I think it's worth a conversation of why those policies are important, why they're implemented, so IENs understand what it's about. I'm running out of time here, so I'll be very quick on this slide. But I think the most important thing to think about when you're thinking about retention is that retention is much more than simply just satisfaction with your job. If IENs and other professionals are going to stay in a position, especially in rural Manitoba, it requires a very strong connection to the community, and it requires a connection to the position and to their home lives and family lives. So we aren't just about our jobs. And when we're talking about retention in jobs, we have to really focus on community integration and making sure that there's a fit with families and with other parts of their lives. This slide comes out of a research study that I've just finished and writing up now for publication. And it looked at a 10-year follow-up of nurses living and working in rural Manitoba. And of all the themes that came up, the only thing I'll point out to you is out of the 6 themes, only one of them in terms of retention focused on their job. Everything else was the community, the home, feeling connected to the rural people around them, and really focusing on living, and work was part of that, but it was not all of the picture. So the last thing I will actually, maybe I will just very quickly touch on this, but if you are planning a recruitment campaign or planning to introduce many internationally educated nurses into your organization, it's important to consider these key elements. Your goals need to be aligned. You need to include the right people. So maybe it's the regulator, maybe it's employers, maybe it's educators. Coordinating it and making sure someone is connecting all of the pieces, that people are committed to the project, and that remembering that as policies change, it's a very interconnected system. So if the regulators make a change to policy, that's going to impact on your recruitment. So just last thoughts: workforce integration and community integration are interconnected. So when you're thinking about retention, you need to think about family reunification, eligibility for permanent resident status, as well as your workplace integration. Settlement supports are also a key piece to consider. Early integration into the workforce can ease the transition to life in Canada. And it's important as much as possible to get these nurses into the workforces as quickly as possible. Family and community connections are key. And words and actions become an integral part of the story for internationally educated nurses. Acts of kindness are remembered and have impact, and likewise, unsupportive acts are remembered. So I will leave it there.
Wonderful. Thank you so much, Catherine, for that excellent presentation. And I see there's several questions which we will get to in about 20 minutes. And so I'm going to hand the virtual podium over to Susanne.
Thank you very much. I just want to say right off that unfortunately I was diagnosed with COVID on Monday, and so I'm asking for assistance with the screens just in case I need to take a break and have a little sip of water. So I'm going to dive right in. I would like to acknowledge that we are in New Brunswick, the St. John River, the Wolastoqey. It's primarily Maliseet, Mi'kmaq, and Passamaquoddy peoples. And as it was mentioned in my bio briefly, I did have the privilege of being the community health nurse in 2 Maliseet communities. And so we're very grateful to be working and living in their territory. So next slide, please. I think it's very important to just give a brief. I know I only have 20 minutes, and this I want to get right to the meat of the modules because this is what I think we're here about. But Catherine gave a beautiful segue in to what I'm going to speak about because of all the evidence that she brought to the table. We have experienced in just 1.5 years or 1 year and a few months some of the things that she has shared with you today. And so our mentorship program is designed primarily to support the new nursing employees, both those who are Canadian educated nurses or internationally educated nurses. But in addition to that, when you are developing a mentorship program, if you have one, you know this already, you're not there just for the new hire, but you're there to support the teams in which they're integrating, the managers and the organization as a whole. Again, they have a positive impact on both that new hire, that mentee, but also the mentor and the entire team as a whole. Next slide, please. So our team was brought into fruition. We're literally 1 year old. Horizon Health Network is the English health authority in New Brunswick. We are officially a bilingual province, so we do have an English and French health authority. And so we were brought together. I literally, along with someone who's on the call today, Liz Evans, we did interviews and we hired, in total, including myself, 9 registered nurses to start literally 1 year ago, just a little over 1 year for some of us, this mentorship team. So there's myself as the regional director of NP practice and nursing retention. I did have a title change in January because now I have a dossier that focuses with NP practice. There are nurse mentor coordinators scattered across our organization. We have one who is specifically mandated to address mentoring needs and onboarding needs, integration needs of the IENs. And then we have retired registered nurses and nurse practitioners who also fall under our team or our portfolio. And one thing that's, I think, key to note in our health authority, we call the unregulated care provider a PCA. So you might call them a PSW or a resident attendant, but it is the unregulated nursing care provider. So we not only interface and work with the newly hired LPN, RN, and NP, but the PCA as well. Next slide, please. To give you an idea of the numbers of the numbers we're speaking of, we're an organization of over 14,000 employees, and just under half of those are registered nurses. I don't have an exact number, but well over 6,000, but I believe it's under 7,000. So a lot of a nursing team there. Just before I go any further, you might want to know, so what is the internationally educated nurse coordinator? What is her focus? Catherine Driscoll is her name, and she does I put it in red, a lot of cultural awareness presentations. Started to change the name more to be mentoring, the IEN, instead of focusing on culture because it's more than just culture. Um, she helps manage, navigate, and facilitate the successful integration of the IENs into Horizon. So we are called Horizon Health Network. She works collaboratively. As I said, there are nurse mentor coordinators scattered across our province. And so, because there's only one of her and seven of them, she relies very heavily on working together and collaboratively with all of us on our team, and myself included. So, for example, there was a phone call or a Teams meeting yesterday in which she herself was involved, myself as the director, and then the local nurse mentor coordinator. So you can see where, if you are limited in the human resources of the number of persons that you can have to be formally responsible for something like an IEN program, it is very, very useful to think of who already exists in your system and how can we network with them to have that cross organization coverage. So I'm going to move on. Next slide, please. The nurse mentor coordinators are key. And I'm going to say right up front that they have done extraordinary work in the last year. We were mandated to not only come together and create a team, but to start interfacing with new hires in September of last year. A lot of our teams started August 22nd, one September 6th, and then a couple of us joined in the summer. So, and Catherine, the IEM, was in late spring. So you can see we had this scattered onboarding. We had to create a framework, create a program while executing it at the same time. Liz Evans, who was a part of the previous, from 2003 to 2013, there was a provincial mentoring program in our province. She really shared with me the importance of mentorship workshops and preparing the team, encouraging the team that's bringing in and orientating and working with all of the new nursing hires. And so, to encourage them through and to educate them um, through modules, mentorship modules. And so that was something that we knew we really wanted to do and to do it as soon as possible. And so, along with providing support and doing on-unit mentorship checks and collaborating with managers and the universities and the colleges, these nurse mentor coordinators, along with myself, we we knew we had to formalize a framework, and then we had to create mentorship modules for the mentors and the nurse managers and the educators and anybody else who wanted to take them to be better prepared to welcome and to know how to better mentor and educate on the job our new nursing hires, including IENs. Next slide, please. So this brings us to our nursing mentorship development workshops. As a team, we looked at evidence, so what's out there, the different theories, the research, and also what we were seeing, themes in areas, what was working well, what was not working well, what were some of the learning gaps that were knowing and hearing either from educators or nurses themselves or the new nursing hires. One of the things that was very evident is that we needed to create a workshop that talked about developing a mentoring culture. Why, in today's day and age, with everything that's going on in healthcare, do I really need to make it a priority for my team, my staff, to invest into having a mentoring culture? I want to say that this came right from the very top, the CEO, the CNO. It has been invested over the last year, not at the beginning, because again, mentoring culture and the priorities of, all of the different healthcare crises, it's seen as a soft side of nursing. And so it took some time, but persistence paid off. So that first module, each module is about 1 hour in length, and they are offered virtually, in person, or in e-learning modules. And I will get that on the next slide. But workshop 1 is really just about that mentoring culture. Workshop 2 is effective communication. As it was alluded to with Dr. Catherine, that a lot of communication needs to happen. We need to be heard as humans, and we need to be understood. So that leads into workshop number 3, the adult learning style. We do learn differently. And so this workshop really focuses on things to consider when you are the mentor that is onboarding that new staff member. Transition shock. There's great work that's out there. And so we took that 1 hour, or we do take that 1 hour, the team does, to discuss transitional shock and things to consider. And then workshop 5 is that mentoring. It's solely focused on mentoring the internationally educated nurse. I share this today because whether an IEN or not, workshop 1, 2, and 3 build very much into workshop number 5. And so that's the way we approach this. Of course, we're wanting to get the most bang for our buck, so we're thinking of all new hires. But regardless of whether you are educated here or in the Philippines or another country, that culture's needed, effective communications needed, the adult learning style needs to be taken into consideration, and there is transitional shock. So that's how we took this and thinking about it as a building block. Now, someone can, if they missed workshop 1, take workshop 1 after they have completed the others, but it is preferable if you take 1 and go through 1, 2, 3, 4, and 5. Our organization felt it was important enough that it is paid. So that 1 hour, so that's why we know virtually they're a 1 hour workshop. They're very interactive. But if you do it in person or the e-learning module, which you can go to the next slide, please, either or, they all take about 1 hour to complete. So, after successfully implementing virtually and in person the nursing mentorship workshops, we took those knowing the workplace reality of registered nurses, LPNs, PCAs, nurse managers. It's not always easy to even step out of a unit, or to come home, or to come in from home, or to sign in from home, depending on what's in your personal life, to do a virtual workshop. And so we created with Learning Development Services um, the nursing mentorship e-learning modules. So literally worked with our learning experts to take the slide decks, the speaker notes, those virtual presentations, and turn them into e-learning modules. This gives, again, when you think of adult learning, we're trying to target not only a workplace that is, short-staffed and stressed and things of that nature, but we're trying to also address how people learn. Some might learn much better in an e-learning module, whereas some might never want to do that and will want to be in person, or They might be someone that prefers that interactive, but they want to do it virtually and not go into the actual hospital setting to receive that education. So, again, if you're with Horizon Health Network, whether you're attending in person, virtually, or doing the e learning module, you're receiving the similar, very, very similar learning experience. As an incentive, it's just a lot of us have continuing competence requirements with our regulatory bodies. If you successfully complete all five, you get a pin and a pewter type pin, and that identifies you as a mentor. And our chief nursing officer has committed to signing a special certificate that we hand deliver. One of the local nurse mentor coordinators delivers to um, the successful recipients once they've completed all five of them. And again, this is just an incentive to encourage them to do that. It also is good for your CV or your resume. I am going to stop right here and share that when we started to stagnate, and I felt like, and our team was kind of wondering, why aren't we getting a little more buy-in from some areas than we are in others? Um, I went to the executive leadership and I spoke with them, and our chief nursing officer that I work under her direction, we spoke, and it was very much in a meeting, strongly encouraged that leadership needed to encourage managers to talk about these modules with their staff, to encourage the importance. So, to any of the formal leaders in the audience today, I say that that is key to, if leadership sees this as noteworthy, encourages it, verbalizes it, then that will trickle down to the staff, and I believe that we are going to continue to see uptake in these learning modules. Next slide, please. I'm almost done. I just want to speak briefly. This is not about an e learning module, but I do want to say, if anybody after today would like to learn more, we are more than honored to speak about our retired registered nurse mentorship program, because many of us are strained with trying to find mentors. Our chief nursing officer, being the visionary that she is, did not go to Department of Health, did not go to social development. She went to post-secondary education training in labor, PEDAL, and she pitched an idea about having a pilot program in which we would bring in retired registered nurses, give them these mentorship workshops, work with them, and then send them out into the areas in which they were experts. They retired from being these nurse experts in these different units to be retired nurse mentors. And we launched it in November 2022. We started with the emergency departments in our three larger centers, and we have since branched out. We now even have a retired nurse manager that is working with new nurse managers. And we also have one, and hoping to soon have the second, retired nurse practitioner to mentor those novice nurse practitioners. Next slide, please. And so, the only other thing I want to say about this is that the nurse managers, if you're going to have a retired registered nurse come back to be a mentor, we depend on working very closely with the unit manager, because they fall under our team, but they are working with mentees who are part of another manager's team. And that's all I'll say with this slide. Next slide. So the success to or the risk to success with the nurse mentorship program, including the uptake of getting the staff to do modules and learning modules. If you're not going to make them mandatory, but you're going to strongly encourage them, it's that lack of engagement in the beginning from leadership and the mentors and the mentees alike, because again, as I mentioned, it's not a quick fix. It's a um, it's a multi-step investment of both time, money, and energy. Um, One of the things, it came down to communication. How were we communicating? So we met with our communication experts at Horizon Health Network and said, we need help. Help us strategize to think about how we can get investment into uptake of these learning modules. And one of the other things is that the impact of mentorship and the role of a nurse mentor coordinator is not always highly valued as much as like an educator or someone of that nature, because you are a support, you're an adjunct to the professional team. And so again, that is a risk. Next slide. So evaluation and metrics, so as I said, we're new. We have right from the get-go created data. We created qualitative in case somebody wants or is interested in doing research. We are gathering data along the way in all of our different programs, including the impact of the learning modules, the mentorship workshops. And so again, that is something that I strongly encourage if you start to build in any type of a program to think about what are we wanting to measure as an impact, um, not only for quality improvement of the program we're offering, or to, in the instance of modules, to improve the modules, but what impact are we having on our nursing team as a whole or nursing as individuals? Are they more likely to mentor after doing our mentorship workshops? That's the type of data that we're measuring. Next slide. And this is just an example. I put this in here. It's my last slide. I'm writing to you in order to convey my sincere thanks. I know you're just doing your job, but for me, the very fact that you come and find out how I'm doing, and if there's anything to help, is very calming and comforting. I know I'm not the only one who feels this way, and some of my colleagues are also grateful that they can turn to you for advice and assistance in both small and big things. So again, keep it up and thanks a lot. And that came from a new employee in the emergency department at one of our urban hospitals. And then I believe my last slide is just the references. I know that there's some people who do like to look at references and where we gathered our data from. So I just wanted to plug that in there. And I thank you very much, Mariah, and the rest of the M4 team for allowing us to share.
Thanks again, Susanne, for this presentation and for sharing this wonderful program with us and the importance of these modules. And I see there's several questions in the Q&A, so I'm just going to jump right on. And Catherine and Susanne, I'll invite you to turn your cameras on if you're able to. This first question is directed towards you, Catherine. And you mentioned it takes 3 years for IENs to feel comfortable in their nursing practice. How does that compare to the time it takes for new Canadian nursing grads to feel comfortable?
Yeah, so excellent question. And I think the reality is that in terms of how comfortable somebody is going to feel, how confident people are, is very individual. And it partly depends on the person themselves. It also depends on the setting. There is no doubt that Canadian new grads also do experience challenges with integrating into a new job, with the whole transition piece. I think for us, what's important is that we're asking and figuring out what the issues are. So rather than jumping to the conclusion that somebody is lacking in knowledge, the type of support we give someone when they're lacking in confidence is just a little bit different. So I think it's really more the acknowledgement more than the time frame, because I think individuals and all new hires will have various needs and requirements for support. But it's making sure we're providing the right support. So rather than sending them to a book to read or a policy manual to read, it might be about saying, you know what, I'll do this with you. And then the next time I'll watch you do it. And just providing them with those that support to build their confidence. I think the main difference for IENs over Canadian grads is that IENs are unfamiliar with the role and scope of practice, and that takes time to learn that role and to be confident in the assertiveness, in the interprofessional communication, all of those pieces.
Wonderful. Thank you so much, Catherine, for that response. And Susanne, you had mentioned a 1-hour workshop that was titled Mentoring Internationally Educated Nurses. Can you tell us a little bit more about the contents of this module?
Thank you again, everyone, for your patience with my voice. I'm not sure if Catherine's online or not. I know some of my team came online to learn from Catherine Baxter, but also um, to support me. I know that it's been a while since I did it, but Catherine very much talks about culture. She talks about things to consider that, for example, it's not broad strokes. When you talk about an IEN, they don't all come from the same country. They don't all come from, um, the same working environment. So there's things of that nature. She speaks of language. So things that we take for granted, like if I say, I'd like a 2x2, or I'd like a flannel, or what do you call that little, she has a picture of it. It's what we often call the Christmas tree, when really it's an O2 connector. Things that we just speak colloquialisms in the East. We might have some sayings that, again, we don't even think about it. We just speak. So that's addressed. There's also things to that she addresses as in the sense from a culture perspective, that here we are expected to advocate, but what if I'm coming from a country where if I advocate as a registered nurse, I might be um, I might be reprimanded, or we've even had said people say, if I spoke like that in my home country, I would be reprimanded or disciplined. What about people who come from an area where there is a physician, because it does exist, the physician is there 24 hours a day on the unit. So my role in advocacy or in decision making, I might have the head knowledge, but I'm not called to look at the lab values and interpret them and then phone the physician. The physician's there with me. And directing me on what to do, what next steps. So again, she really, this whole module is, yes, it does talk on culture, but it's about taking the extra steps, things to consider, because if you think of being educated in Canada and doing your preceptorship and your clinical in a Canadian institute as a privilege, if you look at it that way from an ethical perspective, then if I don't have the privilege of being educated and trained in my clinicals in a Canadian healthcare system, I am not the same as a new hire that has had the same experience. And so just the whole hour really gives information and things to consider when you're mentoring an IEN that might be different from a Canadian graduate who is a novice nurse.
Thank
I
you,
hope that
Susanne.
answers. I will say, Mariah, that we are willing to share outlines of our e-learning modules and things of that nature. We just are a very open team, and so if someone wanted to connect with us, we are very willing to share that, have conversations
Wonderful.
about the details and so on.
Wonderful. And with the recording, we'll make sure that we include a link to those modules that Susanne is mentioning. I'm sure there's several attendees today, very, very curious about their content. And so this next question is for you, Susanne. Do the recently retired nurses that you mentioned that are part of the mentorship program have to maintain their nursing licensure?
Yes, so they're a registered nurse. So We are a unionized province. If you work for the health authorities in our province, you are part of the New Brunswick Nurses Union. And so the way that we've gotten around that is they're a casual position. And so we worked with our bargaining unit to make sure that there wouldn't be grievances or anything. And as an incentive, if we're bringing you back for this year, we're going to have to evaluate it year by year, but we pay their licensure fee.
Great, thanks, Suzanne. And this next question is for you, Catherine. I think this will be our final question of today. What training is provided to rural coworkers and supervisors in order to better understand the IENs and IENs who are facing racism? This is a big area of feedback that this a person asking the question gets feedback from IENs, and they just note that policies can sometimes take a long time before we actually see them working.
Yeah, a very, very good question, and probably one that could be a whole webinar in itself to answer. I think there's a few pieces. I agree. Many jurisdictions have policies in place, but if policies are not followed up on, and if there's not the follow through with conversation and discussion and education, it's not going to be effective. There's a few things we've done in Manitoba. One of the things we did before internationally educated nurses went into rural facilities, we offered a series of preceptor training workshops. And we've also done some one-day in-person sessions for managers and educators on essentially what Susanne was just referring to there, of what are the differences between working with IENs and trying to tease out and prepare people for the fact that the support that's required is different. It's not necessarily more, it's just different. So that IENs may be incredibly good at organization and managing multiple tasks, but they may require additional support in something as simple as how to operate a blood pressure machine. And those can be things that if people are prepared for how to provide the right support, that can help. I think, though, it's something we're going to have to grapple with in terms of how we address racism and discrimination. I think it's much more than education. And I think it's an ongoing conversation as to how we can do it more effectively. But I think at this point, we need to name it, and we need to be very, not just say, oh, that is, but that's not okay, and follow up with staff and also with the individual who is at the receiving end. A great deal of racism and discrimination for internationally educated nurses actually comes from patients. And so that's also a piece that needs to be acknowledged, and IENs need to be given some supports and guidance as to how to react to that and how to respond to that. So I'll leave it there because I know time is of the essence, but yeah, a really good question and definitely room for more conversation.
Great. Thank you for that fulsome response, Catherine, and completely agree that really could be a whole webinar or webinar series in itself. And I just want to thank both yourself, Catherine, and you, Suzanne, for joining us here today and sharing such excellent information. I hope it's inspired some of the attendees to take it back to their own organizations. And I had mentioned earlier that today's webinar would mark the launch of N4's checklist for recruiting, integrating, and retaining internationally educated health professionals. This checklist was co-developed in consultation with health employers from across Canada, and it's intended to support healthcare employers with creating a welcoming space, ensuring a sense of belonging for internationally educated health professionals. So I invite you to scan the QR code here today. We'll also put a link to this checklist in the chat. Please do share with others within your organization or within your networks. And on the page that it takes you to, there's also several other resources, including an employer toolkit for recruiting and retaining international experience that we hope that you find valuable. And you're welcome to join us for other upcoming webinars. We have several webinars that fit within our employer series on recruiting and retaining international experience. These are free to attend, and we hope to see you there. And before we wrap up today, I just wanted to give the final word to Catherine and Suzanne. Do you have any last key messages that you'd like to leave with our audience today?
I'm just going to echo Suzanne's remark that just when working with internationally educated nurses, just to remember each person is an individual and their needs are going to be different. And it's about asking questions and having conversations and addressing those needs as individuals and as people. So I'll leave it there.
And for me, one of the things that I'll add in addition is to learn from your mistakes. We have learned so much in just 1 year, and also to be that example as a team. So we literally have had moments when we have felt deflated, when we have felt angry. But again, being a mentor to each other to say this isn't acceptable. So, how are we going to not just react to it, but how are we going to address it? And that could be anything from a racist situation to there not being the supplies or the time or the people to help us properly orientate this group of internationally educated nurses that we know are brilliant, smart people, but just have different learning needs than what we're used to. And we said we got the cart before the horse. That's an old New Brunswick saying. And so now we're trying to catch up in what we should have done in preparing our teams to receive internationally educated nurses, especially into rural areas. It's new. It's new for us, and so to look at your team, who you have, but then to also learn from your mistakes and move forward.
Thank you. Those are some wonderful key messages to leave with the audience. So thank you both, and thank you to everyone who's taken the time to participate today. We hope to see you again.